Good afternoon, everyone, and welcome. It is great to have everybody back with us. Good to see all your faces across this screen. And welcome to our fifth of our weekly COVID panel discussions with key community leaders. This is an event organized by the Tallahassee Memorial Healthcare and reflects the amazing cooperation and collaboration across the entire spectrum of healthcare in Leon County, across our entire community. And I'd also like to recognize our partner, Village Square. They promote civil discourse across our community, and you have a lot of civil discourse right here, so it's good. This kind of information is critically important to you, and the Village Square does a great job. And you will see on the Village Square's Facebook page this entire webinar, so you can go there if you need to later. Also, special thanks to Partners in Communication. You see Rebecca Ray up in the corner, which will have our sign language interpreted for you, for those of you who need that service. And finally, a special welcome to our radio audience on WFSU. Now, this will be broadcast on WFSU Radio Monday at 6:30 p.m. Every Monday at 6:30 p.m. you'll hear the first half hour of this discussion. My name's Gary Jordan. I'm president of the Zachary Group, and I'm here again pinch hitting for Skip Foster. And in what I can only say is just the strangest of occurrences, the reason Skip has not been here the last 2 weeks is because Skip tested positive for COVID. Skip's been very public about it. It kind of spread across his family. Everybody did pretty well. Skip's having a bit of a rough time. All the symptoms that we kind of talk about on this webinar, Skip is experiencing the fever that comes and goes, the headaches, the body aches, the chills, the cough that won't go away, all those things. And Skip wanted everybody to know that because he wants everybody to understand that it's anybody and how serious it all is. So we wish Skip all the best. Love to have him back in this little square next week. We miss him. And Skip, if you're tuned in, best of wishes from everybody, and stay well, my friend. We'll be following your progress. Before we start, if you missed the first of the 4 webinars, this is our 5th, you can find recordings of them along with comprehensive information really across the entire spectrum. And you can find all that, key information, everything else you need to know at tmh.org/coronavirus, tmh.org/coronavirus. And let's get started. Thrilled to have our Senator Loranne Ausley with us today. Actually, that's not exactly accurate. Loranne has been on every one of these webinars, but just as a participant, just like you folks at home. But we invited her into the broadcast today because she and I had a conversation yesterday that I found very compelling about the possibility and the effort to get together a mobile vaccination unit, particularly critical for a lot of the rural areas. So Senator, welcome. I'll start with you today. Thanks for being here on this end of the broadcast. And tell us about, can you update us about what the possibilities are for a mobile unit or what the thinking is?
Yeah, thank you so much, Gary. And Temple and Jeanne and I had this conversation just an hour ago. And the primary focus would be Gadsden County, as I'm sure you'll hear later from some of our panelists. One of the major issues right now is reaching those who are hard to reach. Minority communities, African Americans who are more susceptible to the negative impacts of COVID, but maybe a little less willing to consider a vaccine, and just frankly can't get to a vaccine. And as we get to these high numbers of uptake here in Leon County and across our the Big Bend area, those are the folks we need to get to. And both Temple and Jeanne have mobile units that are not vaccine units. But we're looking at that possibility, particularly in Gadsden, to be able to get around to all the different communities, to get to these folks that really need to get vaccines.
One of the things, and if you talk to Temple and Jeanne, you'll find out that there is a common problem. I'd love to hear your perspective on it, and then I'd like to hear their perspective on it. It's one thing to get the vaccine where people are. It's an entirely different thing to let them know that the vaccine is available. The communication of everything that's happening is pretty critical step.
Exactly. And, Jeanne made the point where a lot of people made the point last week that we're ready for those PSAs, which I think are starting to roll out. And it's really important that it's consistent and consistent messaging with trusted messengers. Again, in our minority communities, that pastors and faith-based leaders and folks who people trust, and to say, this is a safe vaccine and this is where you can get it and this is where it will be available. And it's really important now for those over 65, but as sort of the floodgates open for those with comorbidities under 65, it's just really critical to get that message out.
Let's go to Temple Robinson, the CEO at Bond Community Healthcare. Temple, unmute if you would, and Jeanne, if you could unmute as well. When you hear that, does that ring true for you, that getting the message out is almost as important as letting them know the vaccine is there?
It is. It's. Can you hear me? Okay.
Yeah.
Sometimes it actually is a door-to-door need, because if you're not watching the channel where the PSA is being aired, you're still not going to see it. So it's a grassroots. It's going to take a grassroots effort. And we talk about minorities. We make sure that we include the Hispanic population and the migrant and seasonal farm workers that are out there. You really are going to have to go door to door to get the word out, and you may have to take the vaccine with you while you're out there.
Jeanne, I see you are unmuted as well. Jeanne Freeman is the Chief Executive Officer at Neighborhood Healthcare, Neighborhood Medical Center. Jeanne, this I know has been an issue, particularly in Gadsden, as the Senator said, because everybody doesn't have the same level of communication as other folks.
Definitely. What we've seen a lot from our patients, specifically in Gadsden County, and then friends of our patients, are that they don't have a way to get to a clinic to get the vaccine. So just being able to identify those people has been a challenge. We're finding out about it through word of mouth. A lot of the elderly people in that county may not have family members with them. I had one lady tell me, well, I have to call my kids first and see what they think. And that's understandable. So, I said, well, you call your kids, and if you don't hear from, if I don't hear from you by Monday, I'm going to call you back, and then you give me your kid's number and I'll talk to them. Because, it's that kind of effort that we're having to make in especially the smaller communities right now.
All right, well, we'll circle back with both of you, and Senator, please stay around. I want to go to the mayor. Mayor Dailey, thanks for being with us today. Because we're talking about communication, we're talking about letting people know kind of what's going on. And, I went to the city of it's hard for some folks to weave through a state site, but plenty of folks visit TalGov.
Right.
And on TalGov, you are not only taking the information from the state, but adding local information as well. I went to your dashboard. It's got a pretty comprehensive list of things people need to know, including kind of what's open, what's not, and other services that are happening.
It is, and we're proud of it. First of all, Gary, let me start off by saying how proud I am to work with these amazing professionals that are on the panel. Jeanne, Temple, we've got TMH, they're doing such an incredible job here locally. We all have a role to play. And at the city of Tallahassee, we have two very defined roles. Number one, we support the health department and Claudia that's doing a great job with vaccinations with the fire department at the fire station. But also our role is to communicate and to take the message from the medical community and do the best job that we can to push it out. You are correct. We've got a great website up, and I encourage everyone to visit our website for up-to-date information as well. And we're just proud to be partners in this effort and play our supporting role. On a final note, if I could, personal privilege, Gary, I do want to recognize Dr. Robinson, that was just named the Person of the Year by the Capital Outlook newspaper. Congratulations, Temple.
Yeah.
Very well deserved. Senator, it's great to see you as well. Dean Watson, keep up the great work.
Thanks, Mayor.
Claudia.
Okay, we're going to go around the horn. Claudia, I want to go to you. For those of you who have been watching, you know, that Claudia Blackburn is the health officer for the Florida Department of Health in Leon County. We kind of call her our own. Claudia, first, let's remind folks that for those 65 and over, Leon County is leading the state in vaccinations given. We are really doing a great job here. Kind of bring us up to date on the latest, where we are today, kind of a snapshot of where we are.
Sure. I'll start, and good morning, everyone, or good afternoon. I'll start with just kind of the snapshot of where we are with cases. So we are seeing a decline in our positivity rate, as well as the average number of cases each day, which means that there are fewer cases for us to investigate. Our positivity rate for the last 2 weeks has been 4.64%, so just under that 5%. That's from February 5th through February the 18th, with 93 cases a day. That 93 cases a day is still a lot of cases. We're just, unfortunately, we got used to much higher numbers. So we'd like that 93 to come down, but we are seeing a decline. And we're seeing a decline among the 65 plus age group that is likely associated with vaccination. So we saw a decline from 7.9% of cases to 3.1% of cases from like December 27th through February 13th. So that is really good news. Hopefully the vaccinations are working. We are seeing a disproportionate number of cases in the 18 to 24 year age group. About 30% of our cases in the last 2 weeks have been in that age group. And we continue to hear about gatherings and partying. And so, you know, we again plead with that population to please wear your mask, socially distance, and do everything you can to keep yourself from getting COVID and spreading it. Now, as far as the vaccination program goes, we are continuing our quest to vaccinate at least 80% of our 65 plus population. And right now we're at 68%. Today, I believe we're tied for second, but we're still, you know, in the lead. And we're at 28% of Black individuals 65 plus vaccinated. So there definitely is a huge disparity, and we need to continue to work on that, as you all have been talking about. The health department and our partners continue to vaccinate with first and second doses. And we have a first dose clinic next week. We'll be pulling from the new Share Care registry for folks to vaccinate, and our partners continue to vaccinate as the vaccine comes in. We typically get about 3,510 new doses of vaccine each week, along with boost doses. So we're monitoring closely this week because of the weather delays. Also, FAMU Bragg is opening a site that is targeted for minorities starting, I believe, February 25th, but I would, you know, let them announce that. And they are focusing on the underserved community. They'll be doing about 200 shots a day, 7 days a week. So they're going to be sharing with their partners how people should sign up for services there. So that's what I have, probably more than you wanted, but I appreciate the opportunity to update everybody.
Thank you, Claudia. You did say something that I think probably needs a little clarification. You said some of the vaccine was held up because of the weather delay. Just clarify for folks, that means the weather delays in other parts of the country where the vaccine was coming.
Correct. There are some weather delays in I believe, Memphis, We're not sure, actually. We're monitoring. We're just watching the system, and Kevin may be able to talk more about that, but it changes minute to minute. So hopefully we'll have the vaccine that's needed.
Well, let me then go to Kevin because I've got about 11 questions for Dr. Watson. So let me go to Kevin very quickly. Kevin, for those of you watching, is Director of Emergency Management here in Leon County. Kevin, can you talk about two transportation issues? I'd like to hear if you have any response to what Claudia said, although it may be just what it is, but also the transportation issues that we're facing with getting folks where they need to go here.
Yeah, so first on the weather issue, yes, what we've been hearing is that particularly with the Moderna vaccine, their operations are in Memphis, Tennessee. It's also a major hub for the FedEx, and they've been hit particularly hard with the winter weather over the last week, so it has delayed some of the ability for production, not production, but the preparation for shipping, as well as the ability to get aircraft in and out during some of these waves. So the weather is beginning to get a little bit better. We're hearing from the state EOC that we're expecting Moderna shipments to arrive in Florida. So it sounds like they're getting to where they can get caught back up as these waves of winter weather have passed through the Memphis area.
Okay.
Shifting to your second question, transportation. Are we ready for that?
Yep.
Okay, good. Yeah, so on the transportation, again, Leon County's Volunteer Services Department, Volunteer Leon, they are able to help connect those that are 65 plus or any of those that may have an appointment for a COVID vaccine that have the comorbidities. If they have transportation challenges and they need assistance finding a ride to their appointment, they are certainly welcome to call our Volunteer Services Division at 606-1970. That's a Volunteer Leon. They can assist with making connections to transportation options. Again, that's Leon County specific. Additionally, the city of Tallahassee's Star Metro has an option also for individuals that are using the Star Metro system. All they have to do is show a confirmation of an appointment to their bus driver, and Star Metro will provide free fare to citizens in Tallahassee that use their system to make those connections to their COVID vaccine appointments. So those are the two options that we can tell you about today.
Can you give us the phone number one more time?
Yes, sir. 606-1970.
Okay, thanks. Stay there, Kevin, because we may need you again. Let's go to Dr. Dean Watson. He's the Chief Integration Officer at Tallahassee Memorial Healthcare and at Capital Health Plan. Doc, thanks for being with us. Appreciate it. Bring us up to date, if you would, on sort of the latest numbers. I know hospitalizations are down at TMH, which I guess you would have to say good sign.
Yeah, absolutely. So, yeah, our hospitalization's down to less than 15 at TMH, and I think Trey from CRMC would tell you the same. Their hospitalizations are down as well, all related to all the good work from the panel and all of the practices in Leon and surrounding counties that have partnered with us. And also, you know, hand washing, wearing masks, social distancing, which we're going to continue to talk about. But also just a point to that, and folks, let's focus on another positive. We have seen almost no flu across the state of Florida, across the country, because of all of these things implemented. So that's a positive. So that's relieved a little bit of our stress in the hospital too, because typically we'd have numerous flu patients in the hospital, and we don't have that either.
I guess I'm also hearing between the lines, don't let your guard down.
Yeah, absolutely not. And one of the calls this morning, that question was asked because they were reading the latest study out of Israel stating that Pfizer is 85% effective, and and it works for 28 days or longer. Does that mean I can take my mask off? And I always warn everybody that using one study to direct your focus or your actions is not a good idea. And secondly, none of these vaccines are 100% effective. So you may be in that small percent that really is still contagious or really still may get infected. So do not let your guard down. I would be looking over the next 3 to 6 months, watching what our infection rates look like. Listen to Claudia and her team, listen to the state, listen to the feds of when is it safe to stop doing some of these things. Never stop washing your hands. I mean, that would be insanity. But when can we remove our mask? That will be coming out over the next 3 to 6 months.
By the way, I should tell folks, please send your questions in. We're happy to try and get to as many of them as possible. This one, I thought, and so I'm going to stay with you, Dr. Watson. When my sister in Virginia received her second dose, the nurse told her, we can only guarantee the vaccine works for 3 months. I'd love to hear your sort of data point on that issue.
So the explanation on that is, and it's not just the vaccine, it's also when people ask, hey, I've been infected, how long can I be considered to have natural immunity, right? So the CDC has kind of leaned on a 90-day window. Why? Because those studies really aren't out there. They're being cautious. And they're saying, we know that you're going to be safe for at least 90 days. I wouldn't say it's only 90 days, it's at least 90 days. But what we do know is that let's talk locally for a minute, is that we do check antibodies and many of these folks for various reasons we can talk about, but we have seen antibody production from natural immunity up to 9 months so far, and they still have great antibody production. So the CDC has put it out there. That's what you're hearing people echo. It's a minimum 90 days.
I'm going to pivot over to Jeanne. Jeanne, what are you hearing from folks after they get the vaccine, especially the second dose, that 24 to 48 hour period? What are you hearing from folks?
Definitely from the majority of the people we vaccinated that have had the second dose, they are feeling those flu-like symptoms, fatigue, fever, chills. And by hour 36 to 48, it's usually stopped. We have noticed with a lot of the patients who are older who received the vaccine, because we do have some of our staff who are younger, the older people who received the vaccine, 65 and up, they have not had as many side effects or the flu-like symptoms as the younger crowd that took the vaccine here. So Dr. Foster has been kind of doing her own little study about doing antibody testing to see when the antibodies show up. So we're trying to see what we can do to share more information with everyone.
Let me speak to that real quick, Gary, because I want to caution everybody on that. Jeanne, and I'll talk to Dr. Foster. Remember, the vaccines we're using, the antibody tests that are used for natural immunity don't work for the vaccine. So if you're checking antibodies to see if someone's vaccine is working, the IgG will not correlate. So I don't want people to think if they get antibody tests, oh my goodness gracious, I got the vaccine and my IgG is not elevated. It doesn't mean anything.
Right.
Because,
and let me say that's on.
Jeanne, you muted.
That is definitely testing for people who we know have been positive as well. So not just for people who've just taken the vaccine.
Temple, what do you tell people when they hear that Moderna is so many percentage effective against this, and Johnson & Johnson's coming along and it's only effective this percentage? I mean, how do you sort of manage those expectations?
Well, first, I'd be careful so that their eyes just don't glaze over when I start talking about the research. But we have to remember that the Moderna and Pfizer vaccine, back when their clinical trials started, we only had a few variants that we had recognized for COVID. And when the Johnson & Johnson started, they included early on some of the newer variants that they have the different names, the UK and the South African and so forth. So Johnson & Johnson's efficacy looks at not just the novel virus, the first one that we all knew about, but many other strains. And so that's how they came with this percentage of 72 or 82% because they were looking at a wider cohort of viruses, different, not viruses, but different variants of the virus. I would tell anyone that whatever vaccine your provider has, and when it's your turn to take it, to get it. Johnson & Johnson may end up actually offering a second dose. We're still looking at this. All of this is new and young. And we're finding out that the Moderna as well as the Pfizer vaccine, because of the way it's made, looking at that spike protein, that they can easily tailor that vaccine to cover many of these variants. So if Johnson & Johnson comes your way, as I tell people, it's not a discount vaccine. It's not a second-rate vaccine. Get vaccinated.
Can I echo something there, Gary, real quick? Because Temple and I want to piggyback on that because we're the hospitalization side and we're impacted by all that. I echo everything Temple said, as I always do, and a great explanation. Remind everybody that's watching, 85% of people that get Johnson & Johnson vaccine, you have an 85% chance of having really minimal to nothing, okay? 100% of decreased mortality. So if you give me a vaccine that I say, okay, well, 15% chance I may have something, but 100% reduction in mortality, I'll take it. And it helps us because it reduces hospitalizations over 85%. So that's incredible. It's a game changer for us, and it's one shot.
I want to go back to Claudia for just a minute because Claudia, you know, the president said that they felt like in speech just this last week that they felt like they would have pretty substantial delivery everywhere it needed to be. 300 million Americans inoculated by the end of July. Is there anything you're seeing that says we're on pace to make that happen, or is that still a work in progress?
Well, I think what you're talking about is the capacity of our local system to be able to vaccinate all the people that need to be vaccinated. And what I can tell you is that we're currently working with vaccination sites to prepare for next potential phases and additional, pods, places. And I think Dr. Watson can maybe talk about plans for a collaborative community site so we can all work together to ramp up. Plus, there's funding coming in now so that we should be able to hire people to help with this. And of course, all the volunteers are just pulling together and committed to getting done whatever we need to as the vaccine amount increases.
Well, I want to stay with you for just one more minute because we got a question that came in and you've got about a minute before I have to let go of the WFSU audience and move on. When do you think we will have done, kind of met our 65 and older goals in Leon County so that the next group would be eligible?
So Dr. Watson and I were talking about this before the call. It's that 80-20 rule. We got the folks that wanted it. They worked really hard to get vaccinated. Now we're trying to get the folks that are not so interested. So we have about 12% more to go to get to 80%. And that's probably going to take a lot more work than the first 68% took. So we're getting there. We're getting there as fast as we can. I don't have a specific date, but we could, I'd have to do some math, but it could be a couple weeks if we got those folks interested in getting vaccinated and we get the vaccine in.
Okay, what we have to do, folks, is take just a little bit of a break for the WFSU TV audience. We're going to pause for just about 5 seconds to let them transition so that they can say, that if you're on WFSU, thanks for being with us. We'll see you next time. We'll take about a 5-second pause. Okay, we're back with our regular webinar. Jeanne, could you unmute for just a minute? I want to pivot on Claudia's point. I believe you said last week that one of the problems, and Temple, I'd love for you to weigh in on this as well, is you are getting people who are coming to your door who are not eligible, but are interested in getting the vaccine. I mean, you guys are being contacted by folks saying, I'm ready. Talk about that for just a minute.
We're definitely seeing an increase of that. I think the more people are showing up each day to see if we have extra doses left. How do they get the vaccine? You know, their primary care physician has, and I'm seeing a lot of PCPs sending people to us to say, you know, see if you can get the vaccine, and they're actually coming with letters. And so we're having to educate them on the process that Dr. Watson mentioned earlier about how that special population of patients are, how they're going to be processed to get the vaccine. So we've done a lot of educating the community about going through that referral process.
Temple, how are you handling that at Bond?
The same thing. We have people coming saying, I don't have a primary care provider. Well, Jeanne and I, the first thing we say is, well, here, you need to sign up so you have a medical home, so this never happens to you again. Everyone needs a primary care provider, and then we work to get them vaccinated, and to, you know, if they fall within the criteria to be vaccinated. We also have people coming to us for the second vaccine. They had their first vaccine with their primary care provider or at one of the sites, and now they can't get the second vaccine, so they're showing up saying, can I get vaccinated here? And so I always say, well, Claudia Blackburn said, if you try to stay within the same county, so I guess so, come on. But it really skews the numbers when you start looking at what you have on the shelf and what you've given. I will encourage everyone, get a primary care provider, establish a medical home, so you're never without in another crisis like this.
Dr. Watson, I want to give you a question that we're getting from folks at home. How many COVID variant cases have we had that you guys have seen? And Claudia, this may be for you too, in Leon County or in our area from the surrounding areas. Are you seeing the variants?
That's a Claudia. Claudia, you want to answer?
Yeah, we have had 3 cases of variant of the UK variant thus far. Now, that doesn't mean that there aren't more out there. That's just how many have been sequenced through the random sampling process.
Put 3 in perspective for us. Does that mean you're cautiously optimistic, or does that mean, goodness, we avoided it, or does it mean be careful?
I think it means be careful. It's here, and this variant, I believe it doubles like every 10 days, and this is just probably the tip of the iceberg. This is just what's being sequenced. There's probably quite a bit more out there. We just don't know.
Dr. Watson, I've had a couple people ask for you to sort of repeat the efficacy answer for how long the vaccine might be good for, and how you're sort of measuring that.
Right. So vaccines are, the vaccines we have, Moderna and Pfizer, the studies have shown that the antibody production, the immunity, is good for a minimum of 90 days. But what we know from history, right, from all of our virologists and immunologists, is that it will be longer than that. But what has been studied and looked at is really at 90 days. And we're assuming, and with other vaccines in the history, that this thing will be effective for at least 6 months to a year. Some are longer than that, but all of these studies are ongoing. We're early in the phases of this virus, and there are mutations, and there will be more vaccine changes. But can I shift back, Gary, because you're asking about distribution and need for vaccine. And TMH is in partnership with Claudia, is the largest distributor in Leon and surrounding counties of the vaccine, again, in partnership with Claudia and in partnership with the state. And I will tell you all that, and Claudia knows this, and we talk about this all the time, we have worked on distribution models starting December 23rd. When that vaccine hit the market, TMH and the partners with Claudia and everybody else on the screen, Neighborhood Medical and Bond, our true partners, we came up with a plan. The issue is we still have that plan and we have the capabilities of vaccinating large quantities and numbers of patients, but the volume is not there with regards to vaccines. So when you ask about, are we receiving enough vaccine? The answer to that question from our standpoint is no. But I will tell you, and I give kudos to Claudia all the time, she has gone out of her way to make sure that we are fed enough vaccine to feed our community partners to impact our community and the surrounding counties. And this past week was a major hit because we're the only facility, well, there's two facilities, but we're the only facility that has taken on the responsibility to vaccinate the vulnerable under the governor's executive order. Well, we received extra vaccine prior 2 weeks, right? We didn't receive any last week. So we had scheduled 1,000 people and no vaccine arrived. So we had to scramble to figure out how we were going to fill that. We're doing that today. We're vaccinating 1,000 vulnerable patients today, but we don't have any vaccine for next week. So we're struggling through those things. So we ask about availability and capacity. Capacity is there. Availability could be a lot better.
And
Senator, I'm sorry, go ahead.
Nelson, if I may add, Dean is saying we have people, we don't have a lot of vaccine. Well, I will also say that we also are shy resources, and I'm talking about money for TMH, neighborhood bond, and so forth. For us to continue to care for our community the way we want to, especially uninsured patients, we're going to have some support either from the feds, the state, or locally to do this. The vaccine itself, the serum is free, but the storage, the pharmacy time, the logistics to set up, the breakdown, the paperwork, all of that is costly. And we can't push that back on the patients. The insurance companies cover a small portion of this, but until the federal government or the state government or the local government helps to support all of us, the hospitals, none of us, this will be untenable once the doors open and that we can take all comers. We won't be able to sustain this.
As Senator, I know that in the discussion you and I had yesterday, that was one of your main concerns.
Yeah, the fact that once the floodgates open, that we're not going to be able to deal with it. And the other thing is, I mean, I think it's really important to recognize the hard work that these our partners are doing right here, and without any extra funding. All of these people are doing their regular jobs, and this is all on top of that, without any money for administration, which is quite significant. So these are things I hope we can talk about in the legislature.
Dr. Watson, you brought up a really interesting point that there are a lot of other things happening to people beyond COVID. It is Heart Month, and there are still people having those issues and many more. How do you sort of balance making sure that all the other things that happen to folks are still being treated appropriately, and that the emphasis isn't shifted away from them?
Sure. Yeah. So early on, I'll go back to a year ago. We, as an organization, created a COVID team, and we took the onus upon a group of us, a really small group, quite honestly, to be the main team to provide care for COVID. And that included inpatient care, and then now, which has led to vaccine distribution care. So we made sure that we carved out that responsibility so that we would not affect the capabilities or the ability for our specialists and other primary care providers, et cetera, to provide care to the community or for the community and within the hospital. So it never impacted that. We've always focused on making sure we provide care for the community. And so it's split right down, well, it's split, not down the middle, but it's split so that we had a team, this is all we did. And then everyone else was able to do their job. We did not want to expose anybody to COVID in the hospital. We took our team, trained them, so they were always prepared to deal with it, and it worked. And as I mentioned earlier, December 23rd, when we partnered with everybody on this screen, it worked too. And I just want to say this about ACA and others. They have been fantastic. I have to tell you that reaching out to them, requesting things, they're always there to help. I was just on the phone with Molly an hour ago. She's always willing to help and get us what we need. You know, and I know they've changed over leadership. They're always there. And also the Secretary of Health has been there. We're not complaining about any of that. What we're saying is that the availability and delivery of vaccine into the state needs to increase. And I think it will with Johnson & Johnson. Once that happens, to Claudia's point, our distribution model will work. And we have partnered with the city, and they've done a great job. Kevin's on here has been key in that. And the mayor, you know, making sure that we have everything ready to go. If we get 10,000, 20,000 doses, we're ready to go. And so I just want to emphasize that to everybody. I'm not complaining about anything. I'm just saying we need a bigger truck delivery to the state of Florida, which means a bigger delivery to Leon County and surrounding counties.
Yeah, every county should have a Kevin Peters. He has really done a remarkable job with that. I want to let folks know that I mentioned Heart Month. If you're interested in learning more about COVID and the pandemic's effect on your heart health, join an interventional cardiologist, Dr. John Katapodis, for a virtual question and answer Wednesday, February 24th at noon. Mark that down, Wednesday, because I know there's a lot of questions in this area, and you'll be able to ask the question to the guy who knows the answers. Wednesday, the 24th at noon, and you can register for that today, anytime, right now, at tmh.org/heartchat. tmh.org/heartchat. And let me just tell you again that this webinar, the previous webinars, and all the information you need to know is at tmh.org/coronavirus. tmh.org/coronavirus. You'll be able to look back on this if you missed any information and see the previous webinars, which also have just a ton of interesting information that directly relate to all this. So let me say thank you to all of you, Mr. Mayor, Senator, thank you so much for joining us today, and to the rest of the team, great job. And hopefully, all things hopeful that Skip will be back in this little square next week. Until then, everybody stay healthy, wear a mask, do what you need to do, and we'll see you next week this time.